Hi, welcome to yet another writing video. We have done a lot of writing videos based on replicated case notes, wherein we have done the detailed analysis of the case note, done the data selection, discussed about the data organization, we have seen how to write the purpose paragraph. In this video, we are going to take one of these replicated case notes, to be specific, the most recent replicated case note from 8th March, and then I will be presenting a sample letter based on that case note. Let's figure out what are the mistakes in that sample letter and how it can be sorted out. Okay. Since we have already done a detailed analysis of this case note regarding how to select the data and how to organize the data, we'll not do a very detailed discussion on the data selection. I'll just quickly talk about the data selection, organization, and then go to the sample and do the analysis. So let's begin. Okay, you can see the case note on the screen. You would be familiar with the case note from our previous video on the same case note. Anyways, we'll have a quick glance. So here we understand you're supposed to write a referral letter to a practice nurse. The reader is a practice nurse and it's a referral letter, and the purpose of writing the letter is for requesting continuing care to the patient. And another thing that you have to ensure is that in the letter you have to provide information regarding the condition of the wound, about the condition of the patient's wound and the treatment that you have already provided. So make sure that these two aspects are covered in the letter, and the purpose of the letter should be requesting continuing care. Now based on this, let's quickly do the data selection. Of course, the date is relevant, patient's name, date of birth, age, both are given, you can choose either. Then from the social history, we understand as per the purpose of the letter, we can consider lives alone as a relevant data, widow is not a relevant one, daughter lives abroad, again irrelevant, yoga and daily walking is not necessary. Habits, because you know that from towards the end portion of the case note, you understand that the patient has this infection, so this can be considered as a semi-relevant detail. Then moving on to the past medical history, myomectomy and uterine fibroids has nothing to do with the current condition. Osteoarthritis in the right knee, this is relevant because now the current problem of the patient is also on the same area. The patient has this infected wound in the right knee, so that is really important. And osteoarthritis in hand joints, it's not that a relevant case, but since both are osteoarthritis, you may consider this as a semi-relevant detail. Then uses walking aid, of course you have to say that, because if you have read the entire case note during the 5 minutes of reading time, you would have understood that the patient had a fall because she didn't carry her walking aid. So this has to be mentioned. Then the patient is already on paracetamol and ibuprofen for osteoarthritis. Since you are mentioning about osteoarthritis, if you want you can mention it, even if you don't it's fine. So it is a semi-relevant detail. Then regarding the present medical history, the recent happenings presented with laceration on the right knee, you have to say about that because that is the starting point. Fall on rock, forgot walking stick, yes it is relevant. Then bruises. Pain, it's not relevant because there's no further mentioning regarding the pain anywhere in the case note, so you can avoid that. Then regarding the objective data, what you found out, bruises, laceration 4 centimeter relevant, sand particle of course because it was contaminated, later you find out, so that is relevant. All these are normal values, so for that reason you can ignore them. Then wound swab, regarding the wound swab you can say because later on the test turned out to be positive. Then how you manage the patient, pressure irrigation of course, antiseptic, waterproof dressing, antibiotic, tetanus, then the advice that you have provided, leg elevation, that's also important. Then you have asked the patient to come for a review on 6th Jan. Now let's look what happened on 6th Jan. Wound healing progress, relevant. Suturing provided and vapor permeable dressing provided, relevant. Now the wound swab test confirmed positive for bacterial contamination, so it's an infected wound, that is of course relevant. Now what advice you gave? Advice to continue walking aid and advice not to take bath. So these are the relevant data. And from the plan, what are the what are the actions that what are the services that the reader needs to provide to your patient. Regular follow-up for wound checking and dressing. Relevant suture removal after 14 days. Yes, that again the practice nurse has to do, but this is subject to wound healing. It's not a definite removal after 14 days. It's mentioned that as per wound healing. Now we have selected the relevant data. Now you can organize either starting from the recent happenings, you can start, or else you can start with the past medical history of osteoarthritis. I think that would be better because it gives a good flow to the letter. So I would personally prefer that this organization would be better, because in this case you are telling the entire story, all what has happened, and then you will have to mention that this patient already has osteoarthritis and she has been using walking stick. I wouldn't say it as incorrect, but a better choice would be starting with this background of osteoarthritis. Now let's look at the sample letter. Now, okay, regarding the starting format, 6th January 2024, okay, fine. Then the reader's address, Mr. John Bellows, Wellington Health Center, Wellington, okay, fine. Then the referral line, Mrs. Judith Crawler, 71 years, okay, that is fine. Dear Mr. John, okay, that is fine. Like now, regarding the necessity of putting comma at the end of each line of the address, it's not relevant and it's not necessary. If you are adding a comma, that is fine. But like even when you are ending the letter, when you're writing yours sincerely also, you need to put a comma there. That consistency needs to be there. If you are not adding comma, like ensure that throughout the letter, you don't add the commas in the format. Inside the body of the letter, of course, punctuations are important. Then, dear Mr. John, here a full stop has been added after the title, but here there is no dot or full stop after the title. So this is an inconsistency. If you are using a dot after the title, make sure you use it throughout, or else if you are not using, make sure that consistency, you maintain that consistency throughout the letter. Now let's look into the purpose paragraph. This is the purpose. As you know, the purpose should tell who the patient is, then what is the current problem of the patient, and what the patient requires from the reader. Okay, the patient's name is mentioned, Judith Crawler. Again here there is inconsistency regarding adding a full stop after the title or not. Then what is the current condition of the patient? Infected wound is mentioned, so that is fine on her right knee. And what is the requirement? Ongoing care. All these aspects are fine. Now coming to the grammatical aspect, I am writing to refer spelling. This is one common mistake made by students. 2 F's for refer, only 1 F is there. I am writing to refer Mrs. Judith Crawler, who had infected wound. Now regarding the tense, had means past. Even now the patient has infected wound. You're talking about the current scenario, so it shouldn't be had, instead it has to be has. Who has infected wound on her right knee. And here there is no punctuation. Either it should be who has infected wound on her right knee and requires ongoing care. Either you can write like this, or you can put a full stop and then write she requires ongoing care. Then it becomes grammatically right. So I'm writing to refer Mrs. Judith Crawler, who has infected wound on her right knee, full stop. She requires ongoing care. Or you can write who has infected wound on her right knee and requires ongoing care. That's with the purpose paragraph. Now moving on to the expansion para. It starts in this, it has been organized starting with the recent happenings. Okay. So on 2/1/24. Now here regarding the date format also, you can go for any date format, but again this has to be consistent throughout the letter, because here you have used a combination of digits and words, But here it's only numbers. That shouldn't happen. Inconsistency shouldn't be there. So you have to stick on to 1. Since you have started with this format throughout the letter, you have to follow the same format. On 2-124, she falls down on rocky surface because of forgetting the walking stick. Now here she falls down. This has already happened, so it should be in the past tense. You can say that she fell down, or to make it sound more formal, you can say that she had a fall. She had a fall on rocky surface because of forgetting the walking stick. Here also, to sound more formal, you can say that as she forgot her walking stick. Then she was presented. Another common mistake made by most of the students. We don't say she was presented. With presented, it should be just presented, because presented means coming somewhere, or she came. It has the same meaning as came. To sound it more formal, we are using the word presented. So nobody can present a person. We can say that she was brought to the hospital if somebody else has brought the patient to the hospital. But no such mentioning is there. So it means that the patient came by herself. So it should be she presented, not was. She presented with bruises on thigh and. See, can we use this symbol for and? No. Considering our criterion of genre and style, this is a formal letter, and in a formal letter we shouldn't be using any such symbols. It should be written as and itself. And knees, again, and a laceration 4 centimeter. A laceration 4 centimeter. It's not grammatically right. Something is missing here. A laceration 4 centimeter, you can say 4 centimeter deep. A laceration 4 centimeter deep. Then you started talking about the management. She managed. Who's managing? This she you're referring here is the patient. Is the patient managing, or is the patient being managed? So what it should be, she was managed. You can say she managed only if this she is a healthcare professional. Only a healthcare professional can provide the management. So here we are writing it in the passive form, where we give importance to the patient. So while writing in the passive form, you need to have this was before the verb. So she was managed with low pressure irrigation and antiseptic cream. Okay, fine. Then her wound swab was collected, for which dressing is done. Now for which, what is the use of this connector for which? We use for which for ideas wherein, like, for one specific purpose we are doing another action. For instance, we can say that she had headache, for which paracetamol was prescribed. So a cause and an effect. For a specific cause you are providing an action. But here this wound swab collection and dressing has no connection, no link. So you should be careful while using the connectors. Connectors are yet another important aspect. It's not necessary that you have to use a lot of connectors, but if you're using, you have to use them wisely. It should be appropriate to the context. Here for which is not appropriate because the two ideas you're connecting with for which, that is wound swab collection and dressing, has no relation. So it is not necessary there. And moreover, this wound swab collection should have been written first, before you have written regarding this irrigation. First you could have written this, first not you, I mean the candidate who has written this could have written this wound swab collection first and then talked about irrigation. Okay, now coming on to the next sentence. She was commenced on cephalexin and tetanus. She was commenced on cephalexin is fine. It's an antibiotic. It was started on 2nd Jan and it is to be continued. But regarding tetanus, is it something, is it an ongoing medication? No, it was just a one-time administration. So you cannot say she was commenced on tetanus. You have to say that she was commenced on cephalexin and she was administered or provided tetanus injection. Administered, or you can say provided tetanus injection. Now these are the details of the first day, and now you're talking, let's move on to the details of the review. So it's written on 6th Jan 2024. Now 6th Jan 2024 is the day on which we are writing the letter. So it is better to say today. Today, when you are referring to something which happened today, it's always better to use today. Today, the wound of Mrs. Judith, that is a wrong usage, and Mrs. Judith, that is the first name. You should be Crawler, Mrs. Crawler. We don't say the wound of Mrs. Crawler, then how it should be said? Today, Mrs. Crawler's wound shows, Mrs. Crawler's wound shows good healing. Shows good healing. Here we have used the simple present tense because you are saying something which you have noticed today. Shows good healing. Therefore, okay, therefore can be said here because suturing was done because you noticed good healing, therefore suturing was provided. So, okay, fine. Therefore, after therefore, you need to have a comma. Therefore is fine. Sutured and again symbol is used. Then dressing done. Sutured and then dressing done, like it could have been rephrased in a better way. Therefore, the wound was sutured and dressing provided. Then, although her swab report confirmed bacterial contamination. Now, this is a wrong construction with, again, with the connector although, and you don't use a comma after although. So, although, when you're using although, in the sentence containing although, both the positive and negative aspects should be there. Only then you can use although. So, in this situation, if you want to use a connector to show the contrast, the most apt connector here would be however. Like on, that is today, today Mrs. Judith Crawler's wound shows good healing, therefore it was sutured and provided dressing. However, her wound swab report confirmed bacterial contamination. Okay. Now, therefore, again, therefore, no, too many connectors in one paragraph, it's not at all recommended. So, you can stay away from using too many connectors. Then you can say that antibiotic needs to be, her antibiotic needs to be continued. Okay, that's fine. She was encouraged to use walking aid and showering. Now, showering, it is not encouraged, like it is said that she can shower, but she was asked to avoid bathing. So, that should be written here. That is more logical. She was encouraged to use walking aid and to avoid bathing. And to avoid bathing. Okay. Now, here in this sample, the third paragraph is the social background paragraph, or the social and the medical history written together. So, Mrs. Crawler is a widower, which is actually not necessary, and lives alone. Her daughter lives abroad. This is also irrelevant. She had myomectomy, again a relevant detail included, and osteoarthritis. She had myomectomy and osteoarthritis. Is it past? No, even now the patient is having osteoarthritis. So, it gives a wrong information to the reader. She has walking stick and use paracetamol, uses, but use is not an appropriate word when it comes to medication, and you can say she is on paracetamol, or you can say she takes paracetamol. Now, what you can see is that there is no recommendation paragraph. This happens sometimes with the candidate, like once they feel that okay, they have written the entire story, they have written at length, now it's time to wind up the letter, but the most crucial part of the letter, that is the recommendation, is not seen in this letter. Now, how can we write the recommendation? For here we see regular follow-up for wound checking and dressing, suture removal after 14 days. So we can write this as she requires regular wound monitoring. Maybe instead of checking you can say monitoring and wound dressing. Then suture removal. Suture, when you're mentioning about suture removal, this aspect should also be included. How you can say that? You can say that her suture can be removed after 2 weeks, subject to wound healing. Okay, now, so you know that the recommendation, it's a crucial part of the letter. So it is not seen in this letter, and the purpose, though it conveyed the idea, only if the recommendation paragraph is there, the reader will understand what exactly he or she has to do for the patient. And of course, the letter contains a lot of grammatical errors. Then regarding organization, there have been a lot of issues regarding the usage of words, then regarding genre and style. So for this letter, how much would you give the score out of 500? What can be the score of this candidate? I would like to see your responses in the comment section. Hope you found this video helpful. If you have any doubts or suggestions regarding the corrections that were given, please post them as comments. So stay tuned for our next video. Bye.
Medcity International Academy. Trusted hands forever.